Hi guys, Bree and I are here this morning to talk to you about my current favorite anti-aging treatment. So what kind of got me on the road to wanting to get something that was powerfully anti-aging going for myself is that I'm having a grandchild this year. I'm very excited about that. She is due at the end of November, so woohoo, be a grandma before the end of the year. But I was feeling a little bit frustrated with the lack of strength and support I had in my lower face and in my neck and in my chest. So I started to drill down on what is the most effective way to long term get results. I mean, our fillers look great and they're fun, but I wanted something that wasn't going to wear off every year. I needed something a little bit more long lasting. So my favorite treatment for anti-aging is Sculptra. Sculptra is outstanding. It is like a magic wand of rebuilding your own collagen and elastin. So Bree and I are going to do a little bit of role play as if she is the patient, and we are going to hopefully answer some questions for you on what you want to know about Sculptra and anti-aging options. Bree, you have a big birthday coming up.
I do. I'm going to be 50 this year.
Oh, okay.
And so I did not take care of my skin when I was young. I was one of those girls that was at the beach and did not wear sunscreen. But the thing, I've been able to manage that with IPLs and other things. But one thing that really bothers me is the wrinkles or crow's feet or ickiness on my chest when I sleep sideways. And it bothers me more as I'm aging. So I need help.
Okay, I got you. So that is a difficult area because when you sleep on your side, you've basically got 8 hours, hopefully you got 8 hours a night of that pressure of your breasts, squishing together and collapsing that skin as well as your neck, because it's all connected, is essential. So what we have done is we've developed a protocol of using Sculptra where we can lay the Sculptra. So let me explain to you what Sculptra is. Sculptra is a biostimulant. So this is not a filler. This isn't something that's going to go in and temporarily fill up your wrinkles. It's a biostimulant that is going to lay underneath your skin. Your skin is going to take this biostimulant and rebuild the collagen and elastin support structure that strengthens the surface of your skin, so it's less likely to accordion. Kind of get that accordion smash. So, yeah, the hard part about Sculptra is that it's not a one and done treatment. You can't just do it once and be done with it. Anything that is a stimulant that is going to cause you to regenerate your own collagen takes about 3 treatments to get your best effects. I've been doing this for 18 years, and any treatment that I've done over the years, whether they're lasers or chemical peels or retinoids, it doesn't matter what it is. When my goal is attempting to rebuild collagen, it takes 3 episodes of that stimulation, of that fuel, in order to get it to happen. I think it's just the consistency. It's the repeated fuel that you give your skin to go, build, go.
Will I see results after the first treatment or the second treatment, or do I have to wait till all 3 to see what's going to happen?
Okay, that is a very good question. So it sort of depends on the person, but I'm going to give you a real answer, but it does depend on the person, their metabolism, the quality of their skin, their lifestyle, diet, hydration. It does depend on all of those things. So if you're somebody who's drinking a lot of water and you've got a really good diet with all your colors of the rainbow in it, you're going to build faster than somebody who is smoking and not drinking water, just drinking wine and coffee. Me, maybe. Yeah. So, but my expectation is that the first treatment, the treatment protocol goes like this. It's 1 treatment per month for 3 treatments. When you come in for your second treatment, you will not yet see results from your first treatment. It's too soon and it's too little stimulation. Okay. If you do see results by then, yes, that's awesome, fantastic, keep doing what you're doing, but I don't expect it. When you come in for your 3rd treatment, I do expect that we are seeing some of the results of your first treatment at that point. So
it's like staggered.
Yes. So when you come in for that third treatment, what we'll do is look at the before and afters, and we'll like, look, you're starting, the process is starting, and we cheerlead you on to be excited for waiting for your results, because that's the hard part. It's like when you're investing in Apple stock and you've got to just wait for that money to grow.
Tell me how bad it hurts.
Oh,
Because it feels like a sensitive area, so
okay.
That might make me a little scared.
Okay, it actually doesn't really hurt in that area. Sculptra is actually, it's got very low pain to it. So what happens is that we use a cannula to lay the product under the skin. And what a cannula is a blunt tipped needle-like device. So it looks like a needle to you, but to us, a needle has a sharp tip and a cannula has a blunt tip. So we'll use a little needle to make an entry point, and then we insert the cannula under your skin, and so you only feel just that initial little poke. And to be honest, we can inject you with lidocaine in each of the areas we're gonna put the needle poke, so that you don't have to feel that as well. You can also put numbing cream on, and then there's lidocaine mixed into the Sculptra as well, so the whole area just gets numb. It's not an uncomfortable treatment. We do the chest and the neck. We lay the product in very thin, so you don't really see it or feel it. You still have to do a massage of the product 5 times a day for 5 days after you get the product laid in. That helps the product to integrate with your tissue, kind of get it all spread around. But we do lay it in a very thin dilution ratio. When we put it in the face, we want a little bit more of a thicker substance so that it can have more lift for your face. So it's a little bit thicker whenever we use it in the face.
Also improve my texture, or is it just for the wrinkles only?
Oh girl, it does improve the texture. It's so cool. That was one thing I was really surprised about Sculptra. I hadn't expected this, but I first noticed it on one of our employees, Leanne. So we had laid Sculptra underneath her skin, and she has some problematic skin, pores that show, and rosacea, sensitive skin. We put in the Sculptra just to give her a good lift, but I noticed her skin become glowy, smooth, and bright. It's called the Sculptra Glow. It is a known thing. It's because Sculptra creates elastin in the surface of the skin, so it helps to strengthen the surface as well as build the support structure underneath. But I hadn't realized how pronounced that glow would be. So yes.
Who doesn't want that?
Yeah, right. I know. So so we talked about pain, and we talked about you need to do it 3 times, once a month for 3 months. You also need to wait 12 weeks to see most of your results after your last treatment. So after your 3rd treatment, you're waiting 3 months to see most of your results. You will continue to get results for up to about a year. Okay. Once you hit a year, you've maxed out the results you're gonna get.
Okay, so do I have to go on a maintenance plan to keep it up?
Yes you do.
All right.
So you don't have to redo the initial set of 3 anymore, but I do recommend, so at a year, you've reached your max result, somewhere around a year and a half, do a touch-up treatment. Do one touch-up treatment to keep you going in the direction that you've already gotten yourself to keep you aging backwards instead of aging forward. If you don't do Sculptra, if you don't ever do a maintenance treatment, you will still always be better for having done it, because once you get to your max benefit from Sculptra at the 1 year mark, you have to re-age. So you've delayed your aging process by a year. And you've changed your baseline of where you're aging from. So it will take you years to lose the benefit you've gotten from Sculptra, and you've delayed aging by a few years. So it's fantastic.
All right, so Mike, I guess my last question would be, and this is kind of a fear-based question, but I hear people talk about granulomas and that Sculptra can cause that. What can you tell me about that?
So granulomas are nodules, right? They're ripples, bumps. Well, a real granuloma is a medical condition, but I'm going to use that term sort of loosely on what people would notice, which is lumps and bumps and ripples and dips in the skin. Online, it just all gets lumped into the word granuloma, which is not what all of that is. But some of the negative perceptions of what can happen from Sculptra is lumps, bumps, infections, ripples, and dimples in the skin. So there are that is a real thing. That is something that you need to be concerned about. This is how we mitigate it as the providers. So there's different ways you can dilute Sculptra before you inject it into the skin. It comes to us as a powder, and it's up to the provider to choose the appropriate dilution of that powder for your skin, for the results you want, and for the area we're treating. So here at Skin Savvy, we get super, super good at fine tuning the dilution. I don't just dilute it one way and put it everywhere. We at Skin Savvy will dilute it by a particular ratio for deeper areas like this and this. Those are, and your temples. That area might need a little bit thicker dilution, where when we're laying it on those superficial wrinkles that happen right here and right here, the ones that are at the surface of the skin, then we thin it out and dilute it thinner there. Definitely when we're doing the neck and chest, it's a very thin dilution, and we change that based on the person I'm treating. So if I have somebody with really thin skin, I'm gonna dilute the heck out of it so that the product can spread really well without creating any other ripples, dimples, bumps, and lumps. And I know that the word dilution has a bad connotation. People are like, oh, don't dilute.
Makes it sound like I'm not getting the product that I'm paying for.
Exactly, that is not true. So you are getting all of the product. It's just how flat does it lay underneath your skin. That's all the dilution does. It doesn't reduce the efficacy of the product. It's not Botox. Dilution will reduce the efficacy of your Botox, for sure. But diluting Sculptra just helps it spread and integrate. You get faster results in heavy areas if it's a thicker product. You get better results in thin, weak areas if it's a thinner dilution. So you can actually put it in, you can fine tune it and put little micro droplets of it in acne scars or scars in general. So there is so much possible with Sculptra. Okay, so what we do to mitigate the problem of ripples, bumps, lumps, and dimples is how we mix it. The other part of what we do is making sure the skin is very clean. We are neurotic about keeping the skin very, very clean while we're injecting, because if you happen to say I touch your hair with my gloves on and then touch your skin, I could be moving a bacteria from your hair to your skin and then inject you. I can push that bacteria into your skin, and that can develop into a true granuloma months later. Okay. So we know this at Skin Savvy. We are very meticulous and detail oriented, paying close attention to how can we not introduce any potential contaminant into the injection process. That's what we can do. And then there's something you can do. So you doing your massage is essential to preventing the ripples, bumps, lumps, and nodules that you can put.
Explain that. What do you mean by that?
So you doing the massage for the first 5 days of the product, when we lay the product in, your body, you're going to use your body. You're going to use your face. You're going to use your body. So it's going to try to move the product around, the powder around, the way you move your face. So say you smile, you're kind of scrunching up the powder. If you, so then when you go and you do a little massage of the product, you just lay it flat again. And that allows your body to, pull it and integrate it. It takes about 5 days for it to be fully integrated. So if you're really good about doing your massage, I haven't seen anybody have any ripples, bumps, lumps, or dimples.
So even on my chest, I would massage my chest and my neck and my chin.
Absolutely. Anywhere you get Sculptra, you want to massage it for those 5 days. Yeah. And that's important. So that's what you can do. Also, keeping yourself really hydrated so that, your body won't push the water out to your skin unless you have a surplus of water. Your body is going to use your water to hydrate your internal organs, your brain first, before it pushes out to your skin. So you've got to keep yourself really hydrated in order to provide that fluid for the Sculptra to mix with. So those are the things you can do. Right. Drink your water, massage your face, we'll keep it clean, and we'll thin it out.
Perfect.
All right.
I can't wait. I'm excited to get it and show everybody the results.
Awesome.